Well, good afternoon. My name is Mark Ereth. I'm an emeritus professor of anesthesiology at the Mayo Clinic College of Medicine, and recently I've taken on the new role as the founder and chief executive officer at Transfuse Solutions. Transfuse Solutions is a comprehensive patient blood management, consulting, and data company. We're experts in helping hospitals reduce unnecessary transfusion, reduce complications, improve patient outcomes, and reduce hospital expenditures. Today we'd like to talk about bleeding and clotting, something that's near and dear to all of us. We've all had a little stick in our finger that has to be removed that maybe results in a bandage. It certainly results in some bleeding, some clotting, and some tissue repair. So today we're just going to talk a little bit about bleeding and clotting 101, because it's all about biology and chemistry and even a little physics. So first of all, how do we bleed? Why do we bleed? And how do we stop bleeding and get blood to clot? So I think first of all you have to remember that there's two reasons we bleed. And the first is that we have a vascular injury. And what I mean by that simply is that there is a disruption of a blood vessel. That may be a very small blood vessel like a capillary, or it could be a very large blood vessel like the aorta. So once a blood vessel is disrupted, it's obvious that you have bleeding. Secondly, the other main reason that you have bleeding is because of what we call a coagulopathy. And what that means is that the proteins or the cells involved in clotting don't function as they normally would. And so there is a pathology of the clotting function, or coagulopathy. So the next question is, well, why exactly do we bleed? We know how we bleed, but is there actually a reason that we bleed? Well, it turns out bleeding is actually very, very good for us. And the reason is that if we didn't have bleeding, there would be no mechanism by which the bloodstream could deliver new reparative cells to the site of injury. Because without delivery of new reparative cells, there is no vascular repair, there is no neovascularization, and there is no tissue repair at the site. And so bleeding is very good for us. Finally, how do we stop bleeding and how do we stimulate clotting? Well, we know that clotting is good. We know that we must have vascular control, and sometimes that's as simple as putting a Band-Aid on a small wound or holding pressure over a bleeding vessel. The other thing that we must have is cellular, protein, and inflammatory processes. And so we're going to talk about those right now. So first of all, let's take a big global look at bleeding, okay? And if you take a look at this diagram here, you can see on the very top we've got thrombosis, or blood clotting, and at the very bottom you've got hemorrhaging, or bleeding. And in the middle you've got this gray area, and that's the area of normal hemostasis. And at the top end of that you have normal blood clotting, and at the bottom end of that you have normal bleeding. Now, this is a timeline that starts with a patient going to surgery, coming through the postoperative period, and eventually into the recovery phase. You can see that when a patient comes to an operating room, when we as anesthesiologists put that patient to sleep, there's a change in which the normal hemostatic axis is sitting. And typically, once patients are anesthetized, there's a reduction in blood flow resistance, and that reduction in blood flow resistance reduces the amount of shear force or activation of platelets. And what's important by that is that initially when patients go to sleep for surgery, they actually kind of auto-anticoagulate, you may think of it. And so they tend to be more on the bleeding side. And then as the surgeons make their incisions, as they activate clotting processes, there's a swing up again towards the clotting part. And so you can see this very wide range of what happens when patients come to the hospital, have surgery, and recover. So one of the things that we think is really important is if you're trying to transfuse a patient with a blood product to prevent excessive bleeding, you have to measure clotting function all along this time continuum here. Because if you don't, and if you treat somebody today for what happened hours or days ago with their clotting system, then that would be an inappropriate treatment. Likewise, you wouldn't want to try to predict what's going to happen in 2 hours or 2 days and make a decision on that. And so we know that coagulation is a continuum. Again, we have thrombosis on one side and we have bleeding on the other side. So why don't we normally clot? Why doesn't blood normally clot when it circulates in our arteries and veins? Well, it's about vascular protection, it's about protein balance, and it's about keeping inflammation in check. And the way this is done is depicted in this cartoon here. Here we have a cross-section of a precapillary arteriole, and inside that muscular surface is a single cell lining called the endothelium. And it's the endothelium that provides that vascular integrity, or protects the circulating blood from coming in contact with the proteins and the cells. And what happens in this case is that provides the primary security or preservation of normal bleeding function. Secondly, it's all the proteins involved in modulating thrombosis and fibrinolysis. And those proteins here are depicted, and there's antithrombin 3 with heparins. There's certainly thrombomodulin, and we have the protein S and the protein C systems. All of these work in concert to modify or inhibit thrombin formation, which stimulates clotting, or to activate fibrinolysis, which stimulates blood clot breakdown. And so it's those two things. It's the protein function, it's the vascular endothelial function that help to manage it. And in that process as well is modulation of inflammation. So that's why blood doesn't normally clot as it circulates in our arteries, in our veins. Well, let's take the next step forward and anticipate that we are in the operating room and a surgeon is making an incision, or perhaps you're out playing a sport and you injure an arm or leg, a finger, a toe, and you've avulsed part of a blood vessel. In that case, we denude that vascular endothelium, and that protective lining in the blood vessel wall is now gone, and that exposes subendothelial surfaces. And on those surfaces are a whole number of things such as collagen, connective tissues, proteins, and von Willebrand factor. And it's that von Willebrand factor exposure that stimulates protein clotting here on the far left part of the illustration here, and stimulates platelet adhesion here on the far right part of the illustration. And so it's the protein and it's the platelet function, the cellular function, that gets activated by a lack of intimal presence. Going further, we then have activation of additional proteins, coenzymes, proteins, clotting proteins, cofactors that all lead to generation of thrombin. On the platelet side, we have adhesion, which then moves to activation of the platelet. And in that process, the platelet exudes the contents of its alpha and dense granules. And of course, those contents are things such as vitronectin, fibronectin, energy sources such as ADP or ATP, as well as calcium and some other factors, all that contribute to clot formation. Finally, we end up getting thrombin generation down here in the lower portion of the central part of this cartoon. And then on the lower right portion, we see aggregation of platelets. And that's where platelets collect and aggregate with thousands of other platelets in a very quick fashion. And so what you then see, based on some of the protein sources here that you see on the subendothelial surfaces, these receptors that expose and hook onto platelets, you then start to see this adhesion, activation, and aggregation of the platelet. And specifically with the aggregation of the platelet, which you see in the large circular call-out here, it's that cross-linking between those platelets with either fibrinogen or von Willebrand factor that make for that solid platelet clot. And when all this comes to play, you then have this very stable platelet fibrin clot that you see right down here. The next step in balancing things is a process called fibrinolysis. And fibrinolysis occurs when you have activation or conversion of plasminogen to plasmin. And what then happens is that there is, with this conversion, plasmin then works on the surface of the platelet fibrin clot down here to activate clot breakdown. And so it's this balance that occurs all the time between fibrinolysis and thrombosis that balances bleeding and clotting within our circulation. The interesting thing here is that with contact activation way up here, you actually get some activation of the fibrinolysis activity so that before you even get a blood clot, your body's already thinking about how it would break down that blood clot. So that's what's, I think, most exciting about the area of patient blood management, in that we are able to then modify different therapeutic options to appropriately control thrombosis and fibrinolysis in our patients so that they don't have to have a blood transfusion. So again, it's a delicate balance: thrombosis, hemostasis, fibrinolysis, and inflammation. When we upset this delicate balance, we do so with trauma, with infection, with sepsis or bloodstream infections. We also do it with drugs and various implanted foreign materials. All of these things can have an effect and upset that balance. And so it's important to keep that in mind when you're a patient and when you're someone taking care of a patient. So in conclusion, we know that bleeding is very good. It's important. It's very complex. It's also interdependent. It plays with a number of other things. Clotting is certainly life-saving, and it helps combat life-threatening injuries. And certainly we know that preventing excessive bleeding or clotting requires specific diagnoses, appropriate clinical decisions, and directed and monitored therapy. So I'd like to say thank you for your attention, and we hope to see you again on Transfuse Solutions TV.